name's Rachel Morgan. I'm a Child Advocacy Manager with the Guardian Ad Litem program, and today we're going to talk about substance abuse and child welfare. Okay, I'm going to give you a brief overview of what we're going to cover today, and I want you to keep in mind as potential volunteers with the program kind of your role in understanding substance abuse and how that can help you in your cases. First, we're going to talk about the foundations of addiction. Next, we're going to talk about classes of drugs and their effect on the body. Third, we'll talk about the different treatment options that are available. And lastly, we'll talk about the impact that substance abuse has on children and families. Foundations of addiction. Addictions can be defined as the continued use of a mood-altering, addicting substance or behaviors despite the adverse consequences. So continued use despite pretty significant adverse consequences, negative consequences in a person's life. We have learned through the study of alcoholism and substance abuse that alcoholism is a primary chronic disease with genetic, psychosocial, environmental factors that influence its development and manifestations. It is characterized by continuous or periodic impaired control over drinking, so the user might try and attempt to limit their drinking. Maybe they are trying to limit their drinking only to the weekend versus the week. Preoccupation with the alcohol, so we're going to see some obsessive thoughts where thinking about using substances kind of takes over in increments there. Use of alcohol despite adverse consequences and distortions of thinking, most notably denial. We see pretty commonly that substance abusers are very much in denial about thinking that they have a problem, the severity of their use, and the impact that it has on their life as well as children and families that might be involved. Just one note here, when I use alcohol or other drugs, they're kind of interchangeable, either alcohol or substances. Foundation of addiction, addictions as a disease. In the medical model, addiction is a medical disease similar to other diseases such as coronary artery disease and cancer. This is confusing for a lot of people, family members and loved ones, and a lot of times they bring up the question, why can't you just stop? And so this is a complex question that we're going to try to answer in the coming slides. We'll look at the brain's role in addiction and chemical dependence in the brain. So it begs the question of free will versus compulsion. Is the user using these substances out of free will? Are they making a choice to use each time? Or is there a point when a flip is switched in the brain and it becomes compulsion? Medical science believes that there is a point that a threshold is passed that it becomes a compulsion in addiction. One of the things that they look at to determine that addiction is similar to other medical diseases are these four characteristics, how addiction is similar to other medical diseases. So the first is that it's progressive. It gets worse with time. From the first time that a user injects a substance, potentially, they are going to need more of that substance and then more often. So it gets progressively worse with time, the amount that they need to use. Second is that it's chronic. Unfortunately, people die from addiction very frequently. It does not go away and it can lead to death. Third is that it's treatable, which is always the good news, that there are medical interventions, therapeutic interventions that can help someone reach recovery in addiction, although it's a long process and needs to be maintained for a long period of time. Fourth is that they have identified a cluster of distinct symptoms. That means it's similar. You can look at many different people who use substances and find common characteristics, and they use this technique when they are determining that something is a physical disease. And so one of those is withdrawal, that's common with all substance abusers, and increased tolerance once you're chemically dependent. Next, we're going to talk about the key elements of dependence. The first one is a narrowing of the repertoire, which basically means that the substance user is getting further into their use, it's getting closer to the point where they are potentially dependent, and they're establishing a pattern of use. And so this is going to be noticeable from the outside, that maybe their old patterns or schedules are going to be changing because they're catering kind of some of their time and schedule around using. Next is a salience of use, which is a rationalization of their use, and we'll start to see that past inhibitors are no longer valid. So if a substance abuser would typically not drink on the weeknights, maybe they have their children there at home, as they get further into dependence, they're going to start kind of slowly slipping into that. Next is increased tolerance and cross tolerance. Tolerance is your body becomes used to the amount of substance that you're putting into your body, and you need more of that substance and more frequently in order to produce the results that you're seeking, which is a high, and then also that your brain needs, and we'll talk about that a little bit more later. Cross tolerance is when if your drug of choice is cocaine, but then you start using alcohol, maybe you're in recovery from cocaine, there's going to be some cross tolerance there. It's also very common between opiates and alcohol because they work on the same receptors in the brain. Next is withdrawal symptoms. Some common withdrawal symptoms are going to be irritability, shakiness, being tired, having anxiety. For opiate users, a very common withdrawal symptom is physical pain. Also, seizures are common when you're withdrawing from alcohol and benzodiazepines. Next is a relief of the withdrawal symptoms with use. So if you're an alcoholic and you start shaking in the morning, if you drink some alcohol, you're going to relieve those symptoms. Your body is used to and chemically dependent on the substance, so it requires it for survival. Next is subjective awareness of the compulsion to use. The individual is going to start being aware of their continued use, and they might be aware that they're starting to experience some cravings and obsessive thoughts about using. Okay, these are results from the 2011 National Survey on Drug Use and Health, and it's a summary of their national findings. And I just selected it to put in here because it gives a good kind of picture of how common and prevalent substance abuse is. So in 2011, an estimated 20.6 million persons, or 8% of the population over age 12, were classified with substance dependence or abuse in the past year based on criteria in the DSM. And so it's important to note there that this is substance dependence or abuse, and that's not just simple use there. The DSM lays out the very specific criteria for what meets those categories. Of these, 2.6 were classified with dependence or abuse of both alcohol and illicit drugs. It's very common that substance abusers abuse more than one substance or their drug of choice. And 3.9 million had dependence or abuse of illicit drugs, but not alcohol, so just illicit drugs. And 14.1 million had dependence or abuse of alcohol, but not illicit drugs. We would categorize them as alcoholics. Next, we're going to talk about triggers and cravings, and this information is from the Matrix Institute on Addiction, which is a very large organization, and these models of treatment are used quite widely. We talk a lot about triggers and cravings in treatment because it's important for substance abusers to spend some time identifying what their triggers and what their triggers are, and identifying when they're having a craving so that they can have a recovery plan of action in place. So a trigger is a stimulus that has been repeatedly associated with the preparation or anticipation of use, the use of alcohol or drugs. So something that typically comes before the drug use. So that might be going to the ATM and withdrawing cash. That could be going over to a certain person's house to go purchase drugs. There's a number of things that become triggers. This includes people, places, and things. That's a very common catchphrase in recovery. It also includes times of day, emotional states, and any secondary drug use. So it's important to look at emotional states, anxiety, depression, all of those things can trigger drug use. Secondary drug use, that might be using alcohol, leads them into or craving maybe their drug of choice, cocaine. So it's important in recovery for substance abusers to remain abstinent from all drugs, including alcohol. And next is the most frequently reported triggers by drug class. So they did a survey and drug users reported this to be their most frequent common trigger. For stimulant users, it would be alcohol use, any alcohol use. For opiate or heroin users, it was stress. For alcohol users, negative affective states such as anger or depression. For prescription drug users, it was withdrawal symptoms, insomnia, and anxiety. And for marijuana users, it's anxiety, irritability, and insomnia. Okay. We're going to talk about classical conditioning and cravings, and this kind of gives us an idea of how triggers essentially become a trigger. So we're going to go back pretty far to Pavlov. Most people are aware of Pavlov and the experiments that he did with his dog. So in these experiments, he demonstrated what's called classical conditioning with the use of a dog, a bell, and food. And so what he did was he was preparing to feed the dog. He placed the food in front of the dog so that the dog could visually see the food, and he rang the bell before the dog was able to eat. And so eventually what happened after doing this several times was the dog would begin to salivate, which is the physiological response to the dog preparing to eat the food, even in the absence of the food, because the bell became ingrained in that process. The bell happens, and then the dog gets to eat, and the salivation is necessary for the eating process. So we see that response even with the absence of the food. So the bell is a trigger, and that happens in substance abuse. It might be preparing the needle for use. A lot of needle users report that that's a common trigger for them, any needles. So triggers work the same way in the brain, and they also produce cravings in the chemically dependent brain. So even if you're out in recovery and you are exposed to some of your triggers, it's going to be very difficult for you. You might have some cravings after that. So it's important to, again, keep this in mind for the parents and families that we work with. The initial positive aspects of drug use can lead to obsessive thinking about using and acquiring the drug of choice. Studies show that drugs will override ingrained survival mechanisms. So a study that really illustrates this is a study that researchers did with a mouse. And a mouse's instinctive survival technique is, if they're offered an environment that's light versus an environment that's dark, to go into the dark, because that provides them some shelter and safety. They found that if you give the mouse cocaine and then offer them the environment that's dark versus the environment that's light and has cocaine available to them, they will go to the environment with cocaine, even though they're going against their ingrained survival technique. The brain's role in addiction. People initially use drugs to alter their state of mind. So either they want to feel a feeling that they don't already have, or they want to cover up or mask a feeling that's negative. The reward system is activated, and the neurotransmitters that are responsible for feeling pleasure is released. So drugs stimulate the reward center in our brain. Eating also does this. So it's not necessarily a bad thing that the pleasure center is stimulated, but it's over time the brain stops producing the neurotransmitter because the drugs take its place, and then the brain is damaged, and the brain produces less of the neurotransmitter, so they have problems feeling pleasure without their drug of choice. Then this is what prolonged use does. It rewires the brain, and it damages the reward system, so they're unable to have positive feelings without the drugs. Despite the building and increasing negative consequences of use, which could be incarceration, the loss of a job, the loss of loved ones, the addiction is evidenced by the loss of rational control. Triggers produce a powerful physiological response that drives the user to acquire and use, and that's bypassing the rational thought system, and that activates the limbic system. That's why it's very important for people in recovery to have a plan in place for what they're going to do if they're exposed to stressors or triggers, because it can happen very quickly that they pass over and have a craving. Chemically dependent people will say that they no longer get a euphoria or a high from using, that at a certain point they use drugs just to feel normal. When people are very far into addiction, it's not something that's pleasant for them at all, and they express that, but have the inability to stop using. Okay, we're going to talk about a roadmap for recovery. This is also under the Matrix model. There's 4 stages here, and it's a good thing to keep in mind when you're dealing with families, maybe to think about what stage they're in for recovery. The first is the withdrawal stage. Second is early abstinence, or what's called the honeymoon. Third is the protracted abstinence, or the wall. And fourth is readjustment. Roadmap for recovery, withdrawal stage. For stimulant users, the withdrawal stage is 3 to 10 days, and it includes drug craving, depression, low energy, insomnia, increased appetite, and difficulty concentrating. Stimulant users typically put on some weight during the withdrawal stage because the stimulant suppresses their appetite in their use. With alcohol, it's 5 days up to weeks, and it includes nausea, low energy, anxiety, shakiness, depression, emotionality or ups and downs, insomnia, irritability, and difficulty concentrating, and memory loss problems. It's important to note here that alcohol requires a medical detox, and you can actually die just from the physical withdrawal symptoms of alcohol. Opiates and other prescription drugs, the withdrawal stage typically lasts 7 to 10 days, and they experience pain, nervousness, insomnia, depression, difficulty concentrating, and this also requires medical detox. It's important to note here too that most opiate or prescription drug abusers suffer from chronic pain, so it's going to be extremely painful for them in the withdrawal stage. For marijuana, they experience insomnia, restlessness, loss of appetite, depression, shakiness, and irritability. And long-term users might exhibit aggressive behaviors during the first week. The honeymoon phase. The honeymoon period lasts 4 to 5 weeks typically, and for stimulant users, most people feel really good in this period. They think that they are cured in this period. If a patient has gone to an inpatient treatment program, the majority of them experience some of the honeymoon phase while they're in treatment. And it's very common for them to feel like they're cured and all of their problems are solved and they can just kind of go back to their life. But it's important for them to continue to engage in treatment and plan recovery activities for once they leave treatment. For alcohol, the brain is still healing quite significantly, so they experience unclear thinking, poor concentration, anxiety, irregular sleep, and life might just be feeling too intense for them. A lot of alcohol can help to numb intense feelings, and a lot of people use that to numb, so it's an adjustment for them to feel again. Opiate and prescription drug users, their symptoms can be very similar to alcohol, and the progress and process is very gradual for them. Marijuana, typically there is a strong psychological dependence on marijuana, and while the symptoms are not always as severe, the withdrawal symptoms, as the honeymoon, they are still experiencing impaired memory, speech, comprehension, and decision-making ability. So overall, in the honeymoon period, users are feeling good, and it's important to look forward for the future. The next period typically occurs 6 weeks to 4 months, and this stage is called the wall. In this period, the brain is still continuing to heal from the substance abuse, and so people in recovery may experience continued negative symptoms to include depression, irritability, difficulty concentrating, low energy, and a general lack of enthusiasm. It's pretty difficult for substance abusers to kind of experience or anticipate the wall because a lot of times this is well after they've gotten out of treatment. They've got a taste of sobriety and what recovery might look like. They realize that they can have a pretty good life being sober, and then they still have some hurdles to get over. And so it's important for family members and for people in recovery themselves to be aware that it's common for these things to happen, that their brain is still healing, and to kind of anticipate this period and have a plan in place. Unfortunately, during this period, relapse increases greatly, and the risk for relapse increases greatly because they're still kind of dealing with these negative symptoms, particularly for stimulant users here. Next, and this is the good phase, is the readjustment phase, and this typically begins 120 days after the withdrawal phase. So this is kind of where things might seem to even out. They've got some recovery time under their belt, hopefully have established a good sobriety group and a 12-step meeting, working with a counselor, repairing the relationships with their family and loved ones that they really damaged in their use, and they can kind of continue to maintain their sobriety and their lifestyle of recovery, but they've kind of passed a lot of the hurdles there. Okay, next we're going to talk about some of the classes of drugs. There's several different classes, one being alcohol, next hallucinogens, to include LSD and PCP. Third is inhalants, and very commonly now, dusters that are used on keyboards can be abused as inhalants, and they're very highly addictive. Teens also commonly abuse inhalants. Next is opiates, which includes heroin, morphine, and oxycodone. There's a lot of different types of opiates out there. Next is stimulants, to include cocaine, amphetamine, and methamphetamines. Sedatives include barbiturates, benzodiazepines, sleep aids, and then the next class of drugs is ecstasy, which includes MDMA, which is a pure form of ecstasy. For alcohol is a sedative hypnotic, and it should not be combined with other sedatives such as opiates or benzodiazepines. It can cause death. And what happens is in a sedative, all of the systems of the body, to include breathing and the heart rate, slow down. So if you combine them, it's potentially fatal. It is possible to die from alcohol withdrawal, and a medical detox is necessary to prevent death and seizures. Fetal alcohol syndrome is very common with alcohol abuse or dependence while a woman is pregnant, and that includes physical deformities and marked cognitive deficiencies. Unfortunately, we deal with some children in the system who suffer from fetal alcohol syndrome. Another consequence of alcohol that is fatal is sclerosis of the liver, and you can test for alcohol using a breathalyzer. That's pretty common that we use those in field kits that are portable. Next is opiates. Unfortunately, with opiates, the overdose can be lethal even with the first use. It's very dangerous to use this with other drugs that reduce breathing, similar to other depressants like alcohol. Dependence can develop very quickly with opiates, and tolerance can also develop very quickly. It can really kind of shoot up there. If being used for pain suppression, the user is going to have to continue to increase the dose, thus increasing their tolerance to get relief from their pain. Very commonly, opiates are injected as tolerance increases because it gets into your system faster. You can feel the drug faster. So typically they'll go from various forms of use up to injection. And with injection, we see the risk of contracting HIV and hepatitis. Most field tests will show for opiates that most family services counselors use. They'll test for opiates. Methadone will test positive for opiates. However, Suboxone will only show positive for a test that specifically is trying to pick up Suboxone because it's only what's called a partial opiate. Sedatives. General sedatives will test positive for barbiturates such as phenobarbital. However, these are less commonly abused these days because they're just less commonly prescribed. They're not as readily available as other sedatives. Benzodiazepines are very commonly prescribed and more commonly abused these days, and they're prescribed commonly for anxiety, and some of them are Xanax and Valium. They're very common. Other sedatives are sleep aids such as Ambien and Lunesta. These are commonly prescribed for sleep, and they should not be combined with alcohol. People will black out on if they combine Ambien and alcohol, and could be doing things without knowing that they're doing them, operating cars and things like that. It's very dangerous. Stimulants. All stimulants can cause death and seizure, and sometimes with the first use. With prolonged use of stimulants, we see a psychotic break. It can occur, and sometimes it can be permanent, as the person doesn't recover from the psychosis with the withdrawal from stimulants. So that's a factor. And the psychotic break might look similar to paranoid schizophrenia. With stimulants, Adderall and Ritalin are commonly used to treat ADHD or attention deficit disorder, and they can be very easily abused. The process of cooking cocaine into what is called crack cocaine on the street is very dangerous, but the reason that people do it is because it can be smoked in that form, and it reaches the brain faster. It is very highly addictive because it reaches the brain so much quicker through the smoke. Methamphetamine can be produced from cooking common cold remedies such as Sudafed. This process is very dangerous and often starts house fires, and unfortunately we have several families that have their kids come into care because of they're producing methamphetamines. Children can also test positive for methamphetamine simply by being in the environment where it's being manufactured. And ephedrine is commonly used in diet pills, but it has been banned by the FDA because it causes sudden death and psychotic breaks. Okay, we're going to talk about treatment options. There are several different types of treatment. The first one here is outpatient treatment. So this is where the individual is going to remain in their home environment and go to a treatment center a few days a week potentially. A lot of times they have outpatient in the evenings or during the day to accommodate their schedule. An intensive outpatient program, or IOP, is similar to outpatient. However, typically they have it maybe 5 days a week. It's more intensive. They're going more frequently, and a lot of times they're meeting with a counselor as well on an individual basis through the program. Next is medical detox. This typically occurs at the beginning of an inpatient where they first enter detox, and then after a few days they're cleared to go out into the patient population. However, some people just enter a detox for 2 to 3 days and are released and don't continue with treatment. Of course, it's recommended that they continue with treatment. Next is an inpatient program, and these really vary. Standard is typically 28 days. However, to see more effectiveness and long lasting of sobriety, it's recommended that the patient stay in treatment for at least 90 days. There is full hospitalization, where the patient goes to a campus on site and they live there, and partial hospitalization. Typically this person would go to a facility that's local, and so they'll be there during the day, all day, and then go home at night. Some involuntary programs include the Marchman Act. That's what it's called here in Florida, and this is where the judge can enter an order to have someone in an inpatient facility against their will if they're having trouble with drugs and alcohol. Next is drug court programs, and we see this a lot with either felony or dependency with some of the parents that we serve. Dependency drug court is related to the dependency case, and so they have an intensive outpatient treatment program, and then they have to go to court to help with the accountability there. Special considerations when looking into treatment options include dual diagnosis. There are certain treatment facilities that are specified as being dually diagnosed capable, and what they do is they treat someone who has a mental illness and substance abuse at the same time. It's important to consider PTSD or post-traumatic stress disorder. A lot of programs nowadays have specialty programs that will treat the PTSD and the substance abuse together, because a lot of people who suffer from PTSD end up what's called self-medicating, and then they become addicted to the substance. And then also chronic pain. If a substance abuser starts using the drug for relief of their chronic pain, it's important to find other ways to treat the pain without the substance, so that the person can be successful in their recovery. Some medical treatments to consider. First is methadone. It's pretty popular, and methadone is an opiate substitute. So people who are on methadone, they typically go to a clinic daily and get their daily dose of methadone. A lot of these programs also require them to participate in counseling and therapy, and potentially 12-step groups to make sure that they're maintaining their recovery. Next is buprenorphine. The common name for this is Suboxone or Subutex, and this is a partial opiate. So it is not as it's not easily abused as methadone or other just standard opiates, and this can help with chronic pain as well. It will provide some relief from chronic pain. Most Suboxone patients go to their doctor monthly and get a prescription that they're able to keep at home with them. Next is a Vivitrol shot, or the naltrexone pill. The Vivitrol shot is simply a shot form of naltrexone. It is non-narcotic, and what it does is it blocks the dopamine receptor, and so this helps with cravings, and it also will block any feelings of euphoria or high if the person takes any alcohol or opiates, so it deters their use. Next, we're going to talk about 12-step programs. 12-step programs are very ingrained in treatment programs around the nation, in inpatient as well as outpatient programs. 12-step programs are a lot of times used to supplement treatment. There's Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, Marijuana Anonymous, and Al-Anon and Alateen. Al-Anon and Alateen are for loved ones and family members of the substance abuser, and Alateen is specifically for teenagers. These are the 12 steps that are commonly used in 12-step programs. I'm going to go over a few of the key ones here. First is step 1, and that is that we admitted that we are powerless over addiction, that our lives have become unmanageable. So this is a very important step, that the user admits and speaks out loud that they have a problem and that they need help. Next is we came to believe that a power greater than ourselves could restore us to sanity. This includes the spirituality part of the 12-step program. That's very important to a lot of people. The fourth step is making a searching and fearless moral inventory of ourselves. And typically, getting a sponsor is a large part of a 12-step program. The participant sits down with their sponsor and goes through and writes out this moral inventory. They look at their defects of character, and then they go on with their list of people that they've harmed and make amends. And then going forward in recovery, steps 10, 11, and 12 are continuing this process and making amends as you go along whenever possible. It's important to note here that when a person's early in recovery, it's recommended that they go to a 12-step meeting every day for 90 days. 90 meetings in 90 days is what we typically say. And most people who are successful remain in 12-step programs throughout their life in some way or another. What we find when people relapse, typically they say that they have stopped going to their 12-step meetings, or they're not communicating with their sponsor. So these programs help people become very successful in their recovery. Next, we're going to look at the impact that substance abuse has on children and families. The role of the family members. We're going to look at adult children of alcoholics. There's some interesting information there. The impact on child welfare that substance abuse has, and the intersection of domestic violence and mental health. Okay, we're going to talk about the roles in an alcoholic family. So it's important to keep in mind that these are just, they are not concrete or distinct. You can have a person in the family that maybe fills a combination of both roles, but it's an interesting thing to kind of think about. and it's helpful when families are trying to recover from substance abuse to kind of identify which role they might fill. So first is the alcoholic or the addict, and this person is typically experiencing quite a great amount of pain in their substance abuse. Shame, they might be feeling inadequate and experiencing a lot of fear. At this point, they typically don't have the insight to realize that it's due to their use. As the consequences of their use are impending, they typically develop defenses to push this away from them so that they don't have to be confronted with it. So this includes irrational anger, charm, rigidity, grandiosity, perfectionism, isolation, hostility, and depression. These are all kind of coping mechanisms that they use, and this allows them to stay in their use. Next, we're going to look at the codependent caretaker. A lot of times this is the spouse. However, in families where substance abuse is generational, you might find that this is maybe an older sibling. This person will step in to protect the chemically dependent person from experiencing the negative consequences of their use. So they might pay their bills that month so that the substance abuser doesn't get kicked out. They might lie to the other family members if it's the spouse, to the children, so that they don't think ill of their father and their use. There's lots of things that might happen here. And this is their primary focus, is keeping appearances up to the outside world, so that nobody can really identify that there's a problem. This person isn't able to meet his or her own needs because they remain focused outward, trying to catch all of the things before they drop so that the consequences are shielded from the alcoholic. This person gains insight into the role of his or her, until this person gains insight into the role that his or her behavior plays in this dynamic, things are going to continue on and their life will become more and more unmanageable. This person is typically the spouse in the family. Next is the hero. This is typically a child in the family, and the purpose of the hero is to raise the esteem of the family in general. And this person is typically a high achiever, so the family might say, well, we're not that messed up because Bobby over there, he's getting straight A's, so we must be doing something right. This person is often the oldest child who sees the family's pain and attempts to lift the family up. However, this person tends to become a perfectionist, a workaholic. They might struggle to feel satisfied due to all of their internalized feelings of inadequacy because they're really trying to accomplish something that's impossible. Many family heroes end up marrying alcoholics and then taking on the caregiver or the codependent role. Next is the scapegoat. The purpose of this family member is to pull the focus away from the alcoholic by acting out. So they're a distraction for the family. This person gets the direct message that they are responsible for the family's problems. This person feels pain and guilt as a result of acting out, but remains kind of frozen inside. They're not really able to express that. This person typically grows up to have some issues with authority figures and potentially issues with the law. They're used to kind of getting in trouble. Without the scapegoat, however, all the other roles would unravel. They need someone to blame in this system. Next is the mascot or the class clown. The purpose of this family member is to relieve stress of the family by the use of humor. However, this person is often labeled as immature or a class clown. This person accepts humor as approval, so if you're making a joke and everyone laughs, that's typically how they get their approval. However, they may be unable to express deep feelings and is often self-deprecating as a way to cover their pain. Next is the lost child. This person simply doesn't contribute to the stress of the family because they're low maintenance and oftentimes invisible. This person has little connection with the family, and so they typically don't learn valuable communication and relationship skills. This person often hides their pain by isolating through solitary activities. So a lot of TV watching, a lot of video games, book reading, those types of things. And typically this person, we see them having weight issues, unhealthy relationships with fantasy, and excessive materialism later in life. Next, we're going to look at adult children of alcoholics. Dr. Judy did a lot of research in the 1980s and has continued that research, and she studied adult children of alcoholics, being one herself, and she's come up with 13 characteristics that she found to be similar in a lot of adult children of alcoholics, and she has a lot of research and literature that's very popular. So one of these is that, the first one is that the adult child of alcoholic, they tend to guess at what normal behavior is, because the system that the family dynamic that they're exposed to as children is very erratic, and so they kind of have to guess. They typically have problems following a project through to the end, and that might be due to a lot of broken promises and the alcoholic not following through on things. They tend to lie when it'd be just as easy to tell the truth. They tend to judge themselves very critically. They tend to have difficulty having fun. They might take themselves too seriously. Typically they struggle in intimate relationships. They typically overreact to changes which they have no control to, and that's probably due to a very erratic environment growing up, not having predictability in the environment. They tend to constantly seek approval and affirmation from outside of themselves, from others. They usually feel that they're different from other people, and that there's just something very different about them. A lot of times they're either very super responsible or very irresponsible. Typically they're very loyal, even with evidence that the loyalty is undeserved, and they're often very impulsive. They tend to kind of start in a course of action and don't deter, sometimes without thinking it through. Next, we're going to look at the intersection of substance abuse and child welfare. So how substance abuse really can negatively affect the child. Substance abuse creates an environment in which things can go wrong. Parents might be passed out from using and unable to care for the child's needs. They might leave harmful substances within the reach of the child. The drugs or any harmful objects used with the drugs, so this could be dangerous to the child. They might ingest the substance or injure themselves. Their use is, might have them incarcerated in and out of jail. Or simply the chaotic lifestyle of drug use can lead to abuse, abandonment, or neglect. Parenting skills, the family life at home, and general child rearing practices such as discipline, boundary setting, consistency of care, and reliability can all be affected. The impact on the family. Substance abuse affects families in both direct and indirect ways. And some direct ways might be their mental state. The demeanor of mom might change significantly when she uses her drug of choice. And a lot of times children pick up on this and they say that, Mom, your daddy's acting funny. They're acting different. Also, directly, the substance is going to impair their judgment. So if they're driving a vehicle, if they're making judgment calls they're going to have that impaired judgment. Indirectly, we see their lifestyle being affected, the physical environment of the home. They're not going to necessarily maybe keep all hazards away from the child. The instability of the family. So those are some indirect ways that substance abuse affects the family. Substance abuse adversely affects the parent's ability to manage risks of the child. They have to balance the demands of substance abuse and parenting. So they're probably going to maybe leave the child unattended and lock themselves in the bedroom so that they can maintain their use. Children often perceive the difference in their parents before and after they use. A lot of parents don't think that children are aware, but they really are. And then we also see parental role reversal and role confusion. And the reversal is when the parent and child kind of switch, where the child ends up really parenting their mother and father, and the role confusion kind of comes in before then, when the process is happening before it's really completely reversed, and this can cause a lot of family conflict. Isolation of the user leads to less visibility of the children, so they might pull their child out of daycare as they're getting into their addiction. They might stop going to church and just becoming very less visible in the community. Impact on family continued. We're looking at hazards. In the home environment, we typically see poor standards of hygiene, irregular food supply, so mom might be passed out for a while and not able to get up and go to the store and feed the children, and material deprivation. Inconsistency in the regard for their safety, so there's a lot more accidents that happen when parents are abusing substances. Substance-related accidents can include exposure to supplies and substances themselves, but we also see more falls and broken bones and things like that where the parents aren't closely watching the children. And also exposure to drug dealing related violence or prostitution. Development, this is the disturbance of object relations, the holding environment, and containment. Object relations develops as a child. An infant is learning to develop their sense of self and stability through their interactions with the environment. So if they have positive interactions with the environment, they feel more positive about themselves, and that develops their self-esteem. If they're crying for mom to feed them and mom doesn't feed the child, and they have negative experiences with the world early on, that affects their self-esteem negatively. The holding environment and containment. Containment is where the mother is able and has the ability to contain the negative forces in the world from the child, that the mother has the protective capacity and ability to keep the child safe and have their needs being met. Okay, some factors that we see that contribute to resilience. Fortunately, children are very resilient, and growing up in a home where there's substance abuse or alcoholism doesn't always mean that the child is going to be extremely negatively affected for the rest of their lives. We see children are very resilient, and so some of the factors that kind of help out are having a secure attachment. So if a child is able to form a secure bond with a parent early on in life, that's going to help them out later. Having strong self-esteem, again, this is developed very early on with their experiences with the world. Having a positive temperament helps. Cognitive competence, so if they have good problem-solving skills. Absence of any neurobiological problems or difficulties, such as fetal alcohol syndrome. Absence of early loss and trauma. Unfortunately, we see this a lot with our families. There's early loss and trauma to the child. Awareness and empathy. Having an internal locus of control rather than an external. Being goal-directed, and having the ability to use other adults potentially as resources. Spirituality or religious faith. Good verbal skills, and always a sense of humor helps. Okay, we're going to look at the intersection of mental health and domestic violence and how this is related and really complicates substance abuse. Individuals with mental illnesses that is untreated can turn to substances to self-medicate. So if you have someone who's suffering from bipolar disorder and they're not properly being treated, they might start drinking to relieve their symptoms. It's very common with anxiety, depression, and post-traumatic stress disorder. Drinking and turning to substances can kind of numb their symptoms and avoid dealing with those things. Victims of domestic violence often turn to substances to cope, and they might be experiencing anxiety and depression due to the domestic violence that they've experienced. Batterers often use substances. They might come home from work and they're drinking, and that typically increases the lethality of a potential domestic violence altercation or incident. So those are related. Factors such as mental health and domestic violence can affect the potential that substance misuse will turn into dependency. So if we have other complicating factors in a person, such as mental health or ongoing domestic violence, the likelihood that they're going to cross over from use to dependence is greater. Thank you for participating in the training today. If you want to look at more information about substance abuse, you can go to the Substance Abuse and Mental Health Administration, or SAMHSA, or the National Institute for Drug Abuse.